President Trump declared a nationwide public health emergency to combat the opioid crisis in America yesterday, as we've reported, but he did not issue a national disaster declaration. And a real big difference between the two is money, frankly. Now, under the now current Public Health Services Act designation, no additional federal funding will be directed to the crisis, but federal agencies will be able to devote more grant money already in their budget towards the problem. Experts say that other measures could be far more effective. Joining me now this morning is Dr. Jeremy Mirabile. Mirabile, I'm sorry. Thank you very much. I appreciate you being here. Let's talk a little bit about this declaration. We were waiting for it. He kind of alluded to it. The president did several months ago. Does this go far enough?
Well, at least it's a step in the right direction. There's a lot more that needs to be done, but this will open up the problem to the nation. You know, before the past several years, it had been called a silent epidemic, and now it's not so silent anymore, obviously.
From what you're seeing, and you have vast experience in this, is this specifically prescription drug issues related to addiction, or is this, with the deaths that we've been seeing, mostly heroin addicts who are taking this heroin that is laced with fentanyl, which we know is extremely potent and can kill you?
Yes, absolutely. It starts with primarily having the disease of addiction to begin with. And these chemicals typically start with the opioids. They're very powerful, and they're often prescribed on the front end by providers, maybe even physicians, or they obtain them from a friend or loved one. But when that supply dries up, then we have what's maybe more readily available and or cheaper, which is this heroin issue, and now laced with a very potent opioid, fentanyl, which causes the overdose death.
So it's interesting, then this starts really as an addiction to some kind of painkiller, in which case we know that Governor Rick Scott, as an example, is supposed to, propose major legislation, specifically more than $50 million for treatment. And in that legislation, he's discussed a 3-day limit on prescribed opioids, in addition to some other things. Do you agree with that? Is that enough? And I would imagine there'll be some backlash from physicians as well.
Absolutely. You know, it's a good start because the supply was just overabundant, and we really don't need that. You know, we're really looking at hoping that these funds go towards kind of the pipeline of identifying folks with this condition and then getting them the help they need. So, you know, there's a partnership that's being looked at by the task force in Jacksonville about identifying these folks in the emergency department and then getting them into a treatment facility after this sort of a scare happens in their life. We like to intervene earlier, not have them end up in the hospital, maybe on the front end with education and prevention. So we really need to look at that money going to really a wide range of interventions.
It's interesting because over your shoulder is some video that's playing from a news conference that the sheriff had yesterday. In fact, you can see it just here. I mean, at first when I saw this, I thought it was money, but this is heroin that has basically been confiscated, brought to Jacksonville from New York City. You see something like this in this image. What does it tell you about the fight you still have ahead of you?
It gives me chills because I know that just less than a size of the tip of a pencil for some of this stuff can kill you. Some of the first responders put their lives in direct danger because even handling the material that is around when they find somebody down can be absorbed through the skin.
Anything that you would say to someone watching now here this morning who has a loved one who has a problem? I have a family member who's battled addiction for years, and getting them help in and out of treatment can be really, really hard, but you can't ever give up.
Yeah, no, you really can't, and it's prevalent. You know, we can't say that this only happens 1 out of 1,000 times. I mean, it's as prevalent as diabetes, and we really need to get these folks to places that can help them. They need to go get an assessment, confide in somebody, trust somebody, go ahead and see either your primary care physician, a counselor. Nowadays, even looking on your local web resources, addiction specialist, addiction provider, and let me get at least evaluated and checked before I do end up in the hospital.
And obviously all of the services that are offered at Recovery Keys. Thank you, doctor, for being here. Do appreciate it. And of course, we have an entire section on our website, news4jax.com, that's dedicated specifically to the opioid crisis, with a breakdown of the effects county by county, the number of deaths we've had here in our area. There's also information on how you or a loved one can get the help that we were just talking about with the doctor. Go to our website again, news4jax.com/opioids.